osteosarcoma after failure of standard multimodal therapy, an open-label phase 2 clinical trial. Please.
Okay. Dear Chairman and all the colleagues attending this conference, I'm so honored to be here to present our open-label phase 2 clinical trial of Apatinib for advanced osteosarcoma after failure of standard multimodal therapy. At the beginning of the presentation, we should declare there's no relevant relationship to disclose, and we should thank all the patients and their families for participating in this clinical trial. As we all know, for advanced osteosarcoma, progression upon chemotherapy, the treatment options are very limited. Anti-angiogenesis tyrosine kinase inhibitors have been proved to prolong PFS in multiple trials, including sorafenib, regorafenib, and so on. Apatinib is a TKI that specifically inhibits VEGF2, and during our off-label use, we noticed it was effective for advanced osteosarcoma, and we had summarized it in original paper, which had been published in 2018 April in BMC Cancer. Thus, to objectively assess the activity of Apatinib, we conducted this phase 2 trial. So, what do we know about Apatinib? Here in this table, I had summarized all the anti-angiogenesis TKIs with different media inhibition concentrations. Unlike these TKIs, Apatinib is for continuous usage and highly selective VEGF2. Our primary outcome measures combine PFS at 4 months and objective response rate. Also, we had a patient self-report questionnaire about toxicity and quality of life as the secondary outcome. Here is the procedures. From March 2016 to June 2017, 41 continuous advanced osteosarcoma patients were registered and assigned insert conform for this trial. And finally, 37 patients were analyzed for efficiency. Here is our eligibility criteria and exclusion criteria. Let's see the outcomes. 16 patients had the best overall response of partial response. Thus, our ORR was 43%, which is pretty high comparing to other TKIs. As we all know, sorafenib only 14%. And our clinic benefit rate was 35%, which is almost the same as regorafenib, which had been present in 2018 ASCO. Our PFS, median PFS time was 4.5 months, and our 4 months and 6 months PFS rate were respectively 56% and 36%. During our observation, we did notice tumor shrinkage during using Apatinib with RECIST 1.1. And from the spinal diagram, we can notice after 4 to 6 months of using Apatinib, the tumor rebounded, usually with olig progression. Here is one patient shortly after 4 weeks of using Apatinib. His pulmonary lesions disappeared, and some of them became a cavity, and his femur thorax caused by the tumor had been absorbed. Our median overall survival time was almost 10 months. And from the baseline characteristics, we noticed our target lesion responded differently to Apatinib. The pulmonary lesions obviously responded much more better than bone lesions. And from the dose reductions, we noticed 16% of the patients has dose reduced, and 30% of the patients had temporarily interrupted of using Apatinib because of the toxicity. Although the tumor has been well controlled by this agent, the pain did not relieve, and it became even more severe during the initial 1 to 3 months. And we found a decline in physical, raw, emotional, cognitive, and social functioning with the self-report questionnaire. Why? Because of the toxicity. We have summarized all the AEs and their percentage and the median time to occurrence. And from these forest plots, we noticed that anorexia and hypertension might reduce the HR for developing progression. The limitation of these studies is small study population and absence of a control group. Thus, we conducted that Apatinib is an effective treatment regimen for advanced osteosarcoma patients with high ORR, and the duration of response was almost the same as previous described TKIs. The toxicity of Apatinib was tolerable in adolescent patients. Thank you.